Hello, I'm Kevin Fernando, a GP based near Edinburgh in Scotland. You're watching this video because you've been started on or thinking about starting on an SGLT2 inhibitor medication. In this video, I will outline some general advice you should be aware of if you are taking an SGLT2 inhibitor. SGLT2 inhibitors are generally taken once daily, ideally at the same time each day, with or without food. If you forget to take a dose of your SGLT2 inhibitor, don't worry, just take it as soon as you remember, unless it's nearly time for your next tablet. In this case, simply skip the missed dose and just take your next dose as normal. Do not take a double dose to make up for a missed tablet. With regards to alcohol intake, whilst on an SGLT2 inhibitor, it is recommended to drink alcohol sensibly and within recommended limits. I know, I'm a killjoy. Current recommended limits are 14 units weekly for both men and women, which is equivalent to 6 pints of average strength beer or 10 glasses of lower strength wine per week. Also, try and spread your drinking over 3 or more days if you regularly drink 14 units weekly. Remember, drinking too much alcohol can increase your risk of diabetic ketoacidosis, or DKA, as I mentioned in the previous video. Next, SGLT2 inhibitors should not affect your ability to drive or operate heavy machinery as long as your blood sugar levels are stable. You only need to inform the DVLA when you are started on an SGLT2 inhibitor if your healthcare professional, your doctor, nurse or pharmacist, has told you that you are at risk of low blood sugar levels, also known as hypos, or you've already experienced a hypo, or if you have certain other complications of diabetes. Specific monitoring or checking of blood tests is not usually required after starting an SGLT2 inhibitor. You should have your kidney function checked before starting an SGLT2 inhibitor and then at least once a year afterwards. But if you have a background of kidney failure or heart failure, you may need your kidney function checked more frequently. Additionally, for people living with type 2 diabetes, they should have their average blood sugar levels or HbA1c blood test checked around 3 months after starting an SGLT2 inhibitor. Furthermore, if you're also prescribed insulin for your diabetes or are on certain other diabetes medications such as gliclazide, glipizide or glimepiride, you should continue to self-check your blood sugar levels as advised by your healthcare professional, as doses of these medications may need to be adjusted after starting your SGLT2 inhibitor. Finally, what should you do with your SGLT2 inhibitor if you have an operation coming up? If you're having surgery, a procedure or bowel preparation, SGLT2 inhibitors are usually stopped at least 24 hours beforehand. However, do speak to your hospital team during your pre-op assessment, as advice varies depending on the procedure. Your SGLT2 inhibitor can be restarted after your procedure once you're fully mobile and eating and drinking normally. Well, I hope you found this series of videos helpful and they've explained why you've been recommended an SGLT2 inhibitor and given you a balanced view of their benefits, but also of their potential side effects. Thank you for listening, everyone.